Hi guys, and welcome to How to Gastro. In today's video, we're going to be talking about a very interesting topic, and that is elephantiasis, which is also commonly known as lymphatic filariasis. So let's get started. So what is lymphatic filariasis? Lymphatic filariasis is a human disease caused by parasitic roundworms known as filarial worms. The infection occurs when the filarial parasites are transmitted to humans through mosquito bites. There are three types of worms that are known to cause disease in humans. They are Wuchereria bancrofti, Brugia malay, and Brugia timori, with Wuchereria bancrofti being the most common type. The main manifestation of the disease is the impairment of the lymphatic system, which leads to the abnormal enlargement of body parts, which cause pain, severe disability, and social stigma for the affected individual. So from this definition of lymphatic filariasis, we get that it's an infection caused by this parasitic roundworm, and there are actually three types of these worms that can affect humans. We have the Wuchereria bancrofti, Brugia malay, and Brugia timori worms, and these are all parasitic roundworms which infect humans through the bite of an infected mosquito. So once these worms actually gain entry into the human body, they actually begin to infiltrate the lymphatic system of the body pretty quickly. And over time, these patients will have the abnormal enlargement of various body parts, which actually includes the arm, the legs, the scrotum, etc. And that's why this disease is also commonly known as elephantiasis, because these legs get so big, they actually begin to resemble the limbs of an elephant. So not only do these limbs get severely large, they also cause a lot of pain for the patient, and of course a severe disability, because now they have to carry around this large limb wherever they go. So now that we know what the basics of lymphatic filariasis is, let's take a closer look at how one can contract this disease. So lymphatic filariasis is transmitted to an individual when an infected mosquito bites a person and deposits the larvae of the worm into the skin of the patient. So the larvae actually travel to the lymphatic system in the body where they can mature into the adult worms. And the adult worms may be 1.5 to 4 inches long, which is about 4 to 10 centimeters long, and the adults will actually go on to produce millions of worm larvae, which is called microfilariae. And this microfilariae can actually circulate in the bloodstream and the lymphatic system of the patient. And the infection is spread when another mosquito comes along and bites the infected person and then goes on to bite another person. And in this way, this is how the infection spreads. So if we take a closer look at this image to the left of my screen, it shows us what the life cycle of this parasite looks like. So we'll start at number 1, and here it says the mosquito takes a blood meal from the human. So we have that initial infected mosquito coming and biting this human. And as we mentioned here, the larvae will travel to the lymphatic system where they can mature into the adults. So the adults begin to accumulate in the lymphatic system, and the adults then produce sheathed microfilariae, which then enter the peripheral circulation. So these are all the extended regions of the body, such as the limbs, etc. And then we have another mosquito coming along and taking a blood meal and ingesting some of these microfilaria. So this mosquito now becomes infected with this parasite. And then the microfilaria in the mosquito sheds sheaths, and it penetrates the mosquito's midgut and migrates to the thoracic muscles. And here it produces larvae, and of course these larvae now migrate to the mosquito's head and proboscis, and the proboscis is a little needle-like structure in the mosquito's head, which it uses to penetrate and actually suck the blood from. And in this way, the cycle continues. So here the mosquitoes infect humans, and then the humans go on to infect mosquitoes, and in this way more and more individuals and mosquitoes become infected over time. So now that we know how one can contract this disease, let's take a closer look at some of the signs and symptoms in this disease. So the signs and symptoms of this disease can be broken down into two main stages: the early or acute stage of infection and the chronic stage of infection. So here, in the acute stage, the individuals will begin to develop symptoms around 4 to 7 days after the initial bite, and they may experience a fever, swollen lymph nodes, especially in the armpits and in the groin area, pain in the limbs and the groin, pus collecting in the leg and draining into the skin surface, resulting in a scar, and bacterial infections of the skin and tissues under the skin, because the worms actually block the lymphatic vessels, which makes the immune system less able to defend the skin and adjacent tissues from bacteria. So we'll see these various lumps on the body, and these are actually the swollen lymph nodes or lymphadenopathies, which are most commonly located in the armpit and groin area. And then we can also find various bacterial skin infections, and this is because if the lymph system is blocked by these worms, and the lymph system is actually responsible in carrying around the body's immune cells and defending our body against bacterial infections, etc., this can now result when these systems become blocked. So moving on, let's take a look at the signs and symptoms that may appear in chronic infections. So after many years of infection, the swelling in these patients gradually becomes permanent, which means chronic, and the legs are affected most often, but the arms, breasts, and genitals may also be affected. And this swelling is called lymphedema, and it develops because the adult worms live in the lymphatic system and reduce the flow of lymph fluid from the tissues, causing the fluid to back up in the lymph vessels. So these are actually very backed up lymph fluid in the various lymphatic vessels. And the worms actually trigger a response from the immune system that produces inflammation and swelling locally. So in these areas, there will also be an immune response which triggers inflammation and swelling. So the swelling makes the skin spongy, and pressing on the skin leaves an indentation that does not disappear right away. And this is called a pitting edema. So the chronic swelling may also make the skin hard and thick, and this is called elephantiasis. And in men, as we mentioned, the scrotum can actually swell as well. So how can one go about diagnosing lymphatic filariasis? So we can diagnose lymphatic filariasis by identifying the microfilaria in a blood smear examined under a microscope. So basically a sample of the patient's blood is taken, and we prepare a smear, and we view the smear under a microscope, and we'll actually be able to note the presence of these parasitic worms from the blood smear. And this specific smear shows the parasite Wuchereria bancrofti. So the blood sample will also show increased levels of the eosinophils. So the eosinophils are a type of white blood cells that are found in the blood and increase in great levels when we have an ongoing parasitic infection. So when the body comes into contact with a parasite, we actually note the high levels or an increased level in eosinophils in the blood. And that's the giveaway sign of a current parasitic infection. So we can also do an ultrasound, and the ultrasound may show adult worms moving around in the widened lymph vessels. So this is actually what the ultrasound image looks like, and this is actually called a filarial dance. So the filarial dance sign refers to the twirling motion of the microfilaria, for example, Wuchereria bancrofti, in the dilated lymphatic channels. And it is identified as a characteristic sign of scrotal filariasis. So this is actually a sign of these filaria dancing within the lymphatic channel, and it's called the filarial dance. And finally, let's talk about the treatment of lymphatic filariasis. So typically, lymphatic filariasis is treated with diethyl carbamazine, and this drug is taken by mouth for 1 to 12 days, and it actually kills the microfilaria and some of the adult worms as well. And that brings us to the end of this video on lymphatic filariasis. Thank you guys so much for watching. Hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe, and share. And please make sure you turn on your bell notifications so you'll be notified every time we have a new upload. If you'd like to download a copy of this presentation, you may do so by clicking the link in the description. Take care and bye for now.